Hey guys, this is 42-year-old Adrian. What a cool guy. He's a psychotherapist that's had pain in his neck and upper back for over 20 years. His wife came into me a couple weeks ago and he decided he wanted some care. He's tried to work out, he's been to the joint several times, but none of it's worked. He was impressed by what I did for his wife, so he's here. Here's some of his range of motions showing his back pain. Here's his shoulder pain. He has lots of different little issues. Knee pain, sleep issues, acid reflux, and he's a chronic self-adjuster. We took some x-rays. You can see some of the issues here. Booyah!
Right here. That's gonna be a favorite thing, working on this.
My name is Adrian. I am 42 years old and I am a therapist for psychoanalysts for people with severe mental illness. I've been having back pain for about 20 years, I would say. Upper neck.
Upper neck?
Yeah, higher back. Epidural right in the center of my neck. I've gotten pills. And then I just did exercises that were supposed to be corrective. I went to the joint, but that didn't do anything.
Oh, they have a wonderful set of doctors that have just graduated from school.
It's like the barber college.
Yes, exactly. His wife came in, did a 2-week program with us, and so tell us how she's doing.
She's a different person. She'd been managing without even actually saying anything of how much pain she was in. Everything is a lot different. She's not in pain anymore.
Wonderful experience with her. The thing I remember about her is that she walked out of my class multiple times because she hated me so much. But he brought her back. She endured. She told me no a bunch of frickin' times. I hated her for that. But I still think it got through that thick skull of hers, and she is doing better. And you know who's really doing better? He is, because he has a better wife. So anyway, she didn't do a video because she was scared to be on camera, so I appreciate you sharing that story.
Lower neck.
We have pain between the shoulder blades. He also has right shoulder pain, right?
Yes. Knees, not so much pain right now. I'm always feel unbalanced to leaning toward my right, and my knees cave in.
Terrible sleep for how long?
It's 2001.
Sinus issues. Heartburn once a week. The biggest thing, he's a terrible self-adjuster.
Oh, no, I'm not. He's lying.
Yeah, how many times do you self-adjust your neck?
All day long.
Did it the worst in front of my face. It was like just like an F you to you, Dr. Thayer. When he's in my office with his wife, and I'm like, you should stop doing that. Yeah, I got a couple more weeks left. I can still do this until I come see you.
I'm entitled. Hey.
Any pain in your back there, tension in your back?
No.
Any pain there, tension in your low back?
Tension in the lower back. 3.
Pain in your neck there?
Probably around 70.
How about that?
About a 3 to 4.
Any pain in your knees there?
Yes.
On a scale of 1 to 10, how bad?
I would say probably like an 8 or a 9.
How much pain in your shoulder there?
Probably about an 8 or 9. Going down actually is where I a lot of times feel pain. Like on
Is
the
it
way
right now? Is it down right now?
Like when I went down, I was like, I felt like something.
How much?
Oh, that was probably like a 9-10.
Gotcha, perfect. Okay. Took a look at his x-rays, definitely some reversals, has an occiput issue. His neck is kind of messed up and the arrows point to the x-rays. You take a look at those.
We got left occiput tilt, left TMJ, and lower thoracic arthritis. Here we have a 10-degree scoliosis, pubic bone misalignment, and constipation. 1/3 atlas wear, low reverse curve and arthritis, and we finish it up with sway back and arthritis.
I personally think that most of his issue is him between his ears. So we're gonna go mid-cervical because like I said, it's really like a C4 problem, not a C3 problem or a C2. And so he's a bad self-adjuster. How'd they go? You okay? Good, perfect.
That's nice.
Mid-cervical, C4. I'd like to go through the joint more, but good.
Upsy daisy, Adrian. We always like to help our patients up after the first visit. We're also reminding him not to twist and turn or he will undo my work. As a self-adjuster, they always want to self-adjust, so don't do it. Easy does it. Here we go. Let's take a look.
Feel lighter.
Gotcha. We're going to walk here in a second. When we walk, it's going to help recalibrate your spine, and then we'll check to see how you feel.
Recalibration is very important. We want to spread that neck adjustment through the entire body. It only happens through walking.
Something I don't feel usually.
What
like
is that?
I want to straighten out.
You want to straighten out?
Yeah. I would say just a little bit, feel a little clearer. Like usually I feel like this.
Clear what? In the
Thinking,
brain?
Yeah.
I gotcha, okay. Okay, there was no pain there, right? But is that feeling different?
Actually less pain in the knees.
How was a 3 a minute ago?
Pop. But I would say a 2.
What about there? Any change there?
Yeah, I forgot what I said earlier, but it's definitely less.
Okay.
I would say.
I think it was like a 6 or 7 before.
Yeah, right now I'm at a 3.
Oh, that's way better.
Yeah.
Range of motion wise, how about the pain there though? I think it was a 3 before.
Like 1. Okay.
That was an 8 a minute ago.
That one's about, let me see, about 7.5.
Gotcha. Now lower it down. This was a 9 or a 10.
That one's definitely better.
Gotcha. That was a 9, I think, or 8 on your feet, on your knees, I mean.
Yeah, I mean, I would say it's about a 4 or 5. I feel like I'm cheating because I was here with the missus.
Yeah, but you haven't got to feel it.
Right.
So, I mean, what is it like, the juxtaposition between seeing it happen to your wife and having it feel to your body?
Like, I'll be honest, I'm still like processing.
Exactly.
What just happened, yeah.
Yeah, I just want to get his first impression, guys. He doesn't want to say he's amazingly better because he's kind of in disbelief too, which happens to everybody. I mean, it's just a very common thing. He wants to be better, but it's still hard to believe that he is better in just, how long was that?
Oh yeah, it was quick. And I mean, for me, I feel like the tension that I always feel like I want to like, it's just not.
I got one more story for you.
Yeah.
Why are you here? Your wife said you could go back to the joint, or you could do what? She goes, do you want to go back there? They ain't helping you.
Or withstand this mental abuse.
Exactly. So anyways, she said, go to see Dr. Thayer because I'm tired of spending money at the joint. It's not helping you. Sort of something like that, right?
Oh yeah, I got a grandfather plan too, though.
You got a grandfather plan?
Yeah, the grandfather plan.
What?
$50 a month, man.
Yeah, I think I'd go back after this. I would go back, of course. It's cheap. Okay, say goodbye.
Top of my head.
It does go top of your head?
Yeah.
Gotcha. We call that a referral point, by the way. These muscles have little brains of their own now. Get those released, or you're going to always have headaches or neck pain from when you contract those shoulders.
I feel no pain, and I felt a great deal of pain before.
Yeah. What else do you feel psychologically?
Just clear. Oh man, of all the stuff that hurt the most so far.
But this one?
The
way I just did?
Yeah.
Okay, I'm going to drop down. His angle of his head. So I have to actually angle my adjustment way down. Way down there like that. How you watching it for 2 weeks is different than actually doing it.
Learning through her struggles with the homework and everything, how important it was to do how hard it is to do the homework.
But you listened for 2 weeks, sort of.
Yeah.
You were sort of here in and out.
Mm-hmm.
How hard is it to do it versus watch it?
It's a lot easier to watch, and you don't realize
And
how
criticize.
important- Yeah.
And you're like, you need to do what he says, honey. Yeah.
First of all, I came in here for the neck pain, and I wasn't really paying attention to much else, even though I was kind of had an idea that other stuff was going on. But I'm happy that I'm having better like movement with my knees, and yeah, the back it's definitely the thing that bothers me the most. But when I ignore it, other things start hurting. But now that I can catch when pain shows up, I'm able to deal with it.
Again, none of that made any sense to me either.
Yeah.
So he came in with neck pain. That was his primary thing. You saw it in the first video. Like, if he just fixed my neck, I'll be so happy. How much freaking better is your neck?
100% better.
Exactly. Your right shoulder was an issue too.
About the same, but still.
We've had moments of it's really good.
Mm-hmm.
But I think there's more of an issue with his clavicle and his shoulder, which we're going to get into next week.
I would say it is 20% better.
Sleep. 20 years of tossing and turning.
I would say quality of sleep is about 90% better.
Brain fog that you could hear in this first video, how much better is that?
100% better.
You can think a lot better, right?
Yeah.
Even though he sounds like gibberish, self-adjusting. How much better is it self-adjusting?
I would say about 80% better.
I would
have
say
the
more like
feeling
60 because he's like a crack addict, like a meth addict. He's like, yeah, I quit. I don't know if I can quit.
One of those cheeseburgers.
The knees.
My knees, they're I would say a good 70% better. It's pretty hard, but I mean, you start seeing when you put effort, it becomes easier, and it's a lot of just accepting that you got to do the homework. I mean,
Yeah.
the pills only do so much, and I stopped taking pills. But this is something I'm making a conscious effort to do, and I'm doing better without pills.
Do you think bringing obscure talk about pools and parks and stuff into our conversation actually helps your progress here?
It helps my mental health.
We laugh a lot at him. So anything else I share?
That's all.
Good. Tell your wife thanks for putting me in the class.
Thank you for putting me in the class.
Yes. This boy has a really, really flexible neck, and so I'm adding a little bit of extra rotation here because to lock him out is very difficult. Right there. So listen in. So I can't wait to start working on this clavicle right here. This right here. That's gonna be a favorite thing, working on this. This side hurts. It just tickles me.
Still, this one's just like,
But this one's really painful. Yeah.
it's like, dude, that's the one I defend here.
A little more rotation. This guy has, again, a lot of flexibility, a lot of laxity in his neck. All those years of self-adjusting have not. This is a perfect example of when a patient doesn't listen to you, wastes a weekend. We got to stay on task and do what you're told. I hate them wasting time for themselves. That's really what I hate. Today we're going to get his first Atlas adjustment and let you guys watch. Right over here. He's actually a little nervous. Look at his eyes are shaking a little bit. I was a little nervous because he self-adjusts so much and I've had trouble with the rest of his neck that I was like, is that how it's going to go? Went pretty good. Different, right?
Yeah.
Yeah, you've never had anything like that before, I guarantee it.
Oh no, you're like a fucking exorcist.
Exorcist, right? Funny thing is, everybody goes, if you're just more flexible, I have all these freaking stupid physical therapists and, movement therapists and yoga instructors. If they just was more flexible, you're as flexible as they get, and you still have problems for 20 years. So flexibility is not the key. So we're gonna bring this all the way to range of motion here. Come this way. I can't wait to see how you're gonna do. So we're gonna adjust his shoulder. Good, not too bad, right?
Yeah, I felt it like across my.
That didn't hurt.
No.
Oh yeah.
A little bit of pain there, huh? Mm-hmm. We'll do this one first. Hello, my little friend. Oh, that hurt at all?
Yeah, I felt it hurt.
Okay. Woo-wee. Oh, it already popped. Oh, woo-wee.
Oh,
Shaka, shaka, shaka. You're gonna love this.
motherfucker.
You're gonna fucking love this, man. It's gonna feel so much better.
Oh. She just wants to fuck me up today.
Put my gloves on.
It's gonna get wet.
They're not wet. And you'll feel a difference on these. The reason I like the gloves, by the way, guys, is because they're so sticky. They stick to this fat head, and you can get in there and really adjust deeply. Okay, do it again. Interesting. One more time here. And out. Good. Okay.